Okay.
Medicare Part 2. Yeah, we're doing a second part and a third part about Medicare for All.
Yeah. It is amazing how many hospitals have closed, especially in rural areas, you know? There are cities where they have a hospital and it's maybe 20 miles away, and then another one 15 miles away. For-profit companies have taken over these hospitals, and if it's not generating enough revenue, they close it down.
And it's supposed to be nonprofit.
Regardless of the need in that community. With Medicare for All, new and improved Medicare for All, Bernie Sanders' bill in the Senate, imagine how many hospitals we will need and how many will open up. You know, if you just lost your community hospital, like in Massachusetts, they're closing hospitals.
Really?
And people,
wow.
and people are marching, protesting, doing whatever they can to try to keep their community hospital, because people will die without a hospital nearby.
And think about this. Right now, there's 28 million people without any health insurance at all. 28 million. And there's many more millions that are underinsured. So now, you're going to have 320 to 330. Numbers always fluctuate with the census, but we'll just say 330 as an overestimate. People in this country that everybody's going to be covered now.
Fully covered.
What do you think is going to happen? Hospitals are going to spring up. Suddenly, new clinics are going to pop up. Because guess what? Those doctors who are beholden to whatever the insurance companies tell them what they can and cannot do is like, screw you, I'm going to start my own practice and call my own shots, and I'm going to have my own clinic.
Yeah.
You know, nurses will be able to probably be paid more. I never even thought about that. Think about that. How more important? Because you're going to need tons of more nurses and even more doctors.
It's all
now.
about supply and demand.
Exactly.
Yeah. Talk about your
and medical billing. We were talking about that. His wife works for that industry where she does medical billing instead of she does, right? She does medical billing.
Not exactly medical billing.
Well, her clients are different companies that she bills for their employees, right? That's what she does.
Yeah.
Instead of having that company, basically now it'll be hospitals and it'll be clinics. She'll have even more customers now. Her company will need more customers.
Yeah.
Is because there'll be more people on insurance.
But the bigger point is it's going to be a job creator.
It will be.
You know?
And think of, not only that, think of the silly things like, okay, now there's a hospital pops up, or maybe reopened. Suddenly that mom and pop shop down the street, that restaurant, that convenience store, suddenly there's a Target built down the street, or you know what I mean, or a mini mart or a mini mall. I mean, these things are going to happen. It's going to create jobs. It'll be a very good boom for the economy. It will.
Saving lives can become the new industry.
Exactly.
Instead of killing people around the world.
That's what healthcare is right now. It's not even healthcare. The health insurance is just bankers, and they're just make money off of people getting sick and people dying.
Side note, we need to mention this in every video because somebody's going to say, well, how are they going to pay for that? And I don't want to pay for somebody lazy. Shut up. Shut up.
Please don't start to cry.
Because you had nothing to say when the Democrats and Republicans just voted almost unanimously for Trump's military budget.
$600 billion.
Over 600.
Or more.
No, almost $700 billion.
But we can't pay for health care.
Yeah.
We don't need tanks and planes.
Over $500 billion. We're yelling now, but
we have to yell because you should all be angry like this.
It's a ridiculous amount of money. More than ever in the history of the world.
We've been bombing the crap out of Syria and Iraq and Afghanistan. ISIS is still there, so shut up.
And how many people have you heard bitching about it?
Not many.
Have you?
Rah, rah, rah. When Trump fired those bombs in Syria months and months ago, they were like, yay. Even the Democrats like, yay. And all CNN and MSNBC, yay, he's so presidential.
Yeah, but I'm talking about the regular person. If we're lucky enough to have you watch our video, oh, awesome, thanks.
Make me need a drink.
Yeah, but you haven't been bitching about the $700 billion military budget. We don't have an enemy. Korea's not coming to get us.
No.
ISIS never came to get us, and it didn't cost $700 billion. I mean, good God.
Oh. So let's not get down that rabbit hole. But the point is, It's going to be a tax increase. 2% on us, income tax.
6% on businesses.
Did I say 6%? I mean 2% on us, 6% in businesses.
On business.
And mind you, not everybody makes $50,000. That's the average of what the American person makes. It's $49,000. That's the average. But there's so many people who are poor, obviously, and some people make 150 grand or 250 grand. So think of how that's going to happen. 2%. The 1% is 400,000 and above. So below that is 2%, and then it's just going to be it's a progressive tax. Which that's what kind of system we're supposed to have. It's a progressive tax system. So this will be done easily and upfront, by the way. Like and when you talk about drug prices, their plan is to pay for all the R&D, which is research and development, up front, so they don't nickel and dime us. All of a sudden, you got some Viagra pill. We've improved it. You know how much we waste on that pill. But anyways, and we just put another little color on the pill, and it's new and improved. They didn't change the recipe at all. So that will go away also. So we won't be nickel and dime for all these silly little costs. Like I was saying on the last video about my mom's medicine. Suddenly I'm paying whatever. She's got Medicare, but I'm still paying $80 for this prescription. Why? That will go away. It's not going to happen overnight, but it will go away. And America, you want to make it great again, it will happen. And this is one of the steps to make everything fall in place. Then we go to the UBI, and then we go to free college, and then everything will be... Woo! We'll be back on part